Good morning. I'm Dr. Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is the daily medical tidbit. I want to keep it very basic this morning in the interest of time. When you get your lab work, because there seems to be a lot of lab work being done, and the time is not being taken to explain things to patients. So you will hear things like a basic metabolic profile, or you might hear a comprehensive metabolic profile, right? And then the lab work is done, you don't know what it is, and everybody goes on their business, So basic metabolic profile is called a BMP. It's a common blood test that's used to evaluate the functions of the metabolic functions, right? So remember the word metabolic is in there, right? So it looks at really fluids and electrolytes in the body, right? So it gives you a quick snapshot of your general health, right? And it's often part of a routine checkup, just like a CBC, okay? And what's included in a BMP? Remember, basic metabolic profile, I will keep using the term BMP. The BMP consists of 8 tests, right? Your sodium, right, which reflects the fluid balance and nerve and muscle function. And I've spoken about some of these in the past. Potassium, number 2, potassium. That's crucial for your heart and your nerves, okay? The third lab, chloride. That helps maintain the acid-base balance in the body. It goes with sodium also. Lab number 4, bicarbonate. Bicarbonate. It's reflected as HCO3, okay? That's also an acid-base status of your body. The 5th component of the BMP is BUN, blood urea nitrogen. That looks at kidney function and also your protein metabolism, okay? 6, creatinine. Creatinine is very important. It's a marker of your kidney function and the filtration, because remember, that's what your kidney is a filtration system. Number 7, glucose, right? That evaluates energy metabolism and also screening for diabetes, right? Blood sugar. Last but not least is calcium, number 8. That's important for bone, cardiac, and neuromuscular health, right? Nerve and muscle. All right? So that's the BMP. If your doctor orders a comprehensive metabolic profile, a CMP, comprehensive metabolic profile, that builds up on your BMP. So there is more to it than the BMP. There's 14 tests. All the 8 of the BMP plus albumin. 1, 2, total protein. 3, alkaline phosphatase. And there's no way for me to break down these terms. These are the actual lab names, okay? So alkaline phosphatase is represented as ALP. Alanine aminotransferase is ALT, all right? Aspartate aminotransferase is AST on the blood work, and your bilirubin. These are this with the 8 from the basic metabolic profile makes up your complete metabolic profile. All right? So that's important, to know. And the CMP is typically ordered when you want to assess liver function, nutritional status, etc., because it gives you more information. If you're monitoring somebody for hepatitis, for cirrhosis, for alcohol-related damage to the liver, medication-induced liver injury, then you get a complete metabolic profile because it includes the liver function test that I just mentioned. All right? So these are important things to know, right, when you get your blood work. And the doctors need to sit and explain these things to you also. I just want to take a brief moment to explain what that means in your blood work, right? A BMP versus a CMP. Have a great day. Peace.